Dear colleagues, my name is Danny Buser. I'm an experienced implant surgeon and I'm working now in a private clinic. My main activity today is knowledge sharing and on a global scale, because with the streaming technology, we can do that these days. I want to share a case with a very complex case, and we had a very nice team approach with Samir Abou-Ayash from the dental school in Bern and with Kerstin Kress, a very talented dental technician. It was a live surgery case of the Aesthetic Master course in June 2021. This is the patient in October 2020 when I saw her for the first time. It's a post-trauma situation. Tooth number 22 is fractured. And the radiographic analysis with a cone beam CT shows the big problem. Both teeth have an apical lesion, cannot be maintained, so both have to be removed. As we all know, two adjacent implants, including a lateral incisor, is one of the most challenging endodontic situations we can have. We made the following decision. We removed the tooth number 21 for a socket grafting, and we decoronated tooth number 22 to leave the root in place to avoid then their bundle bone resorption post-extraction. You see the situation, how it was done in November 2020. And then the patient got an adhesive provisional by Samir Abou-Ayash. You see the periapical with the remnant of the root to limit the bone resorption in the area. We left this in place for 6 months. And then you see in May when we started then to do the computer-assisted planning, digital planning, the two missing teeth. You see the spacing is pretty okay. Then the analysis of the cone beam shows, you see that we have enough space to place two implants next to each other. You need to have 3 millimeters distance in between. And then we did the planning with Samir. Here you see then how the planning looked like. And then in 21, in June at the Aesthetic Master course, this case has been presented as a live surgery. Here you see screenshots of these live surgeries. First we removed, of course, the root remnant, then computer-assisted implant bay preparation, implant insertion, then a contour augmentation using a 2-layer composite graft, autogenous bone, and a DBBM. And then we stabilized the bone fillers with a fibrin sealant, double-layer technique with collagen, BioGuide, and then a primary closure. The next one shows the post-surgical radiograph. Most important, the bone volume in between both implants. The soft tissue was exceptional. Very nice, rich volume here at 4 weeks. Then at 8 weeks, we have done with a punch technique the reopening, and then the patient got provisional crowns by Samir Abou-Ayash. You see here the situation 4 days following insertion of these crowns. Now the soft tissue conditioning phase was initiated, and we were very, very optimistic to get a very nice treatment outcome. Here you see 4 weeks later that the soft tissues are filling in. You see very nice bone volume in between both implants, and you see the progress with the provisionals here before and after comparison, so very promising. Then in January, 7 months later, the decision was made to go into final restoration with all ceramic crowns. This was then done by Kerstin. Here you see periapical very stable. And here you see the 1-year treatment outcome with an exceptional result, really one of the best ones we have seen so far in this demanding situation. The bone volume in between both implants is very good, and you see that the papillary situation is very satisfactory. So it's a 1-year follow-up. Of course, I asked the patient if we can do a cone beam CT, and she allowed me to do that. Here you see what we have achieved. You see very nice buccal bone plates at implant number 21 and implant number 22. When you compare before and after, you see then the beautiful treatment outcome we have achieved. Now the patient is in a maintenance care program. I'm gonna see her once a year in my clinic in Bern-Bümplitz, and that is very, very satisfactory, and the patient is very pleased. Yeah, dear colleagues, if you want to learn from our group how to tackle such difficult cases, I can only refer and recommend to have a look at our recent aesthetic master course we had in May this year in Bern. Together with Professor Belzer, I was able to invite 3 international top speakers with Stephen Chen from Melbourne, Ronnie Young from Zurich, and Vincent Femer from Geneva. And of course, the local speakers included Samir Abou-Ayash, Dieter Bossart, Manrique Fonseca, and of course, my dear buddy, Tony Sculian. The online on-demand platform is still available for another 6 weeks. Therefore, we offer the tuition at a much reduced price, in particular for postdoc students, but also for colleagues from industrializing countries. So check out the QR code, and then you will see that we have very affordable tuition fees. Okay, thank you very much, and stay tuned.